Hello, I am VIjay Patel, CEO for Alpha Healing Center, Vadodara, Gujarat. And it is my privilege to have with me.
I'm Dr. I.R. Rajkumar. I'm a consultant psychiatrist with 4 decades of practice in private as well as addiction psychiatry.
Thank you, Dr. Rajkumar. My first question to you, sir, will be that when a family decides to consider a rehab center for their patients or for their members, what would be the key considerations, according to you, that they should keep in mind?
The key considerations would be a safe and secure place, having a psychiatrist round the clock, along with a team of psychologists and paraphernalias that are essential in keeping the patient's mental health as well as physical health in consideration.
Okay. Sir, my next question to you will be that the family hear a lot of things that you can do counseling, online counseling, you can go to a hospital and take medicines. So, according to you, sir, what would be the difference between a patient enrolling himself for a residential program versus the OPD or the online counseling that they hear of?
You just understand one thing very clearly. Addiction is a disease of the brain. If he were to sort of manage it by himself outside with external support, he wouldn't fall into this he wouldn't be a prey of this addiction disease. The very fact that he has gone into a disease state, he needs support. First and foremost is the detoxification which has to be done, because withdrawal features could be severe at times, could be for extended periods. That may be difficult to be managed at home. So an indoor setting would be needed. Secondly, when he's outside, the triggers, the stressors are completely playing into act, and they can make him more vulnerable. Whereas here in the indoor setting, at least a safe, secure environment is there. The triggers are to the minimum, the stress is to the minimum, and help is available on hand to reach out at any point of time that is needed for him.
Thank you so much. Sir, once the family decide that they want to go for a rehab, according to you, what would be the ideal duration that they should consider the patient to be in?
It all varies from patient to patient, but world around, whatever studies have been done, in an average patient, an average time of at least 12 weeks is what is advocated. The period needed is because we have to work through with the personality of the individual, his coping mechanisms, his ability to face the adversities. All these take time to unlearn and relearn. Merely by saying it once or understanding it once, it's not possible. You have to enforce it. From the conscious mind, you have to be able to at least practice, rehearse till the subconscious picks it up and is able to function in that way. Otherwise, it is very easy for him to fall prey in a short duration of stay.
True. One burning question, sir, that the families have heard a lot that after coming out of the rehab, the patient goes back to addiction within 3 to 4 months. So, what do you think can be done here by the family to prevent, or what sorts of advice would you give to such families who are facing this problem?
It is important for the family to understand the addiction disease, being a disease of the brain, is going to take a long time because it is associated with its neurodevelopmental phase. So that is a vulnerability which is going to remain with him all life. The reason why they lapse is whatever they have learned, they do not practice it when they go back, because facing the adversity takes a lot of effort and courage. And it is easy to fall prey to a substance when the stressors are at its peak, especially when they walk out of the rehabilitation center. They many times are overconfident of themselves that, yes, I have understood, I have learned, I'll be able to manage. That overconfidence itself is many a times going to be the uh, Achilles heel of an individual, because that overconfidence leads to complacency. Secondly, lapse is the norm in an addiction recovery program. Complete sobriety does not come up immediately. As it is a lifelong disease, lifelong lapses can be there. If you are continuing your follow up regularly with the therapist and the doctor, we will be able to identify what are the triggers which causes the lapse and what mechanisms can be used to cope up with them. What support does he need, either medically, that is pharmacologically, or therapeutically in the form of therapies, can be given to him even online in the follow up or in the physical follow up as and when it is required. So they have to be in treatment for a long period of time. It could be 3 to 5 years that they would need that hand holding for some point of time.
True. So you are saying that, sir, after the discharge, if the patient and the family come for regular follow up and are in touch with their therapist and the psychiatrist, in a way, it will be a big help to reduce such incidents.
Very much. If they are continuously taking the treatments, the possibility of a lapse is much less.
Sir, what would be the options available to a family where the family is willing to, you see, bring the patient to a rehab, but the patient is not willing to come and stay in a rehab? What are the options?
That's a very valid point, because in any treatment of addiction, motivation is absolutely essential. Now, many a times, the patient suffering from addiction disease may not have the insight and they may deny their problem. Perhaps in that case, an involuntary admission may be needed in a setup where such involuntary patients can be taken up, their mental health evaluated, and if there are any reasons of the mental health being compromised resulting into non-acceptance of the disease, that can be treated till we break the resistance. Perhaps the stay in an involuntary setup would be the option open.
Thank you so much, sir, for your insights, and I'm sure this will be of great help to all the families and the patients who are willing to come out of this problem and decide on their path of journey to recovery. Thank you again.
Thank you.